If I was you, I would be very, very careful about the first vaccine that is available based on the information that it needs more testing. Okay, because President Trump has endorsed using the anti-malaria drug, but there has been widespread information that that may cause a heart attack. So the only time that they're letting you use that in America is under the strict scrutiny of the doctors in the hospitals. You actually have to be in the hospital. You can't go out and buy it at the pharmacy without a prescription, because the doctors know that it may cause a heart attack. So they're probably going to have some of that inside of the so-called new vaccine. So I would be very leery of testing the first vaccine. It needs more clinical study. If you happen to just go get it at random, you run the risk of having a heart attack or dying just from the vaccine alone.
Okay, I may take it. And I'll have to ask my doctors about that, but I may take it.
Anthony Fauci, Trump's leading health expert on the coronavirus task force, has repeatedly said evidence the drug works is anecdotal. Axios reported that White House advisor Peter Navarro has clashed with Fauci on the drug, which the administration approved for emergency use in mid-March, even though no clinical study has been done to test its effectiveness to treat COVID-19.
Chloroquine's been tried for many viral diseases, more than a dozen. It's never been shown to work in those viral diseases for a clinical benefit. And so we have just a little bit of human evidence that it might work. The studies are small, and we desperately need results from randomized clinical trials to see if it's going to have any effect.
Continue to rise amidst the COVID-19 outbreak. Some hospitals have taken desperate measures to deal with the surge. Bodies of the COVID-19 victims were seen loaded into a refrigerated truck using forklift outside Brooklyn Hospital Center over the weekend, as the state's death toll now passes 1,000. British news agency The Independent reported the reason behind using these trucks were because of the inability of the hospitals to house the increased number of bodies in their built-in morgues. As of Monday, more than 66,000 people have tested positive in New York, and 1,218 New Yorkers have died from the virus.